That was amazing. We did it. I feel so grateful. That was such an inspiring session with Chris Moreland, Nalina, and Purna. I've learned so much today from all of our guests, from people in the audience. Uh, so many things going through my head. I've When I first started thinking about disability, after my injury, I started thinking about it was a lot about problem solving and how to like adapt myself and my habits to this life in which I was a bit of an outsider and in a minority. And I looked at disability as a problem to be solved. And it's been an evolution over time to realize that disability is not just a problem to be solved. We are actually the solution. And my mindset has gone from like, okay, what can we do to mitigate people's disabilities to now how do we get more people with disabilities into medicine to improve medicine? People with disabilities are the solution to so many of the things that are wrong with our healthcare system. For the lack of empathic care, integrated care, for not adapting to patients as they age, for not recognizing health disparities. We have a lens that is unique. And as Dr. Maida says, this nobody else has this lens, right? So we are the solution. And you don't need to look very far to know that there are people out there who not only are doing it, but have done it and have thriving, successful careers. This is our word cloud, our Slido auto-generated this. I just put it on here. I haven't even had a chance to look at it yet, but it seems like, okay, if we look in the center, this stuff is pretty obvious: disability, disabilities, medical. Let's look around the edge here. We have excited. Yes, I'm definitely excited and energized, hearing, maybe listening to people. Great. Alexa, off. That was pretty good. Love, good, learning, connecting, happy, together, important, research. I mean, these are some great themes that we touched on today, and I'm feeling all of these emotions right now. I'm feeling a lot of gratitude toward everybody who helped plan this event. Katie Pontius is our event planner in radiology, and I couldn't have pulled this off without her. She was amazing through this process and pulling everything together with Stanford Video. Amy Thomas, who's our web designer in radiology. Denise Pincombe, she's the administrator for SMAC. Louis Tan is one of SMAC's interns who kept track of all the attendees and helped us figure out the breakout rooms and how that would work. Sheila Sanchez, who provided help with all of the accommodations, especially around sign language and closed captioning. Talking about students leading the way, these guys inspired me. Harika, Nina, and Lewis, they're the ones who put together the two case studies that we reviewed today. Compiling the cases and writing up the moderator guides, and I learned a lot from them and very inspired by them. Our biggest financial sponsor for this event was the Stanford Medicine Office of Inclusion, Diversity, and Health Equity. Um, Anna Daplo Garcia and Amy Ho are the people that I've worked with a lot recently. Mary Stutz, who is the Chief Inclusion Officer, has left her role a while ago, but Mary was very instrumental in putting together all of the employee resource groups at Stanford. We didn't have those before Mary arrived, and now we feel like we have these thriving communities for all different kinds of populations. And the new Chief Inclusion Officer is Barbara Hardy, who I haven't had the pleasure of meeting yet, but I'm excited to do so. And thank you so much um, for making this possible. I wouldn't have been able to do it. It wasn't cheap. Thank you so much. My colleagues in radiology, my chairman, Dr. Gambier, who has always been a champion, David Larson, who has also been in my corner, my division chief, Brooke Jeffrey, and my mentor, and Yun Ting, our financial um, wizard in the department. I want to thank all of you for your support, not just for this conference, but over the last 16 years. Sorry, too much gratitude. I got a gratitude rush. This is Bonnie Maldonado and Mogli Faziotto from the Office of Faculty Development and Diversity. When I first founded SMAC through the Faculty Senate, I went to them first, and they were so welcoming and excited, and you know, just made SMAC a part of their community right away. There was no resistance, only welcoming, only support. And I just want to thank them for everything they've done since SMAC was formed, and their financial support and their guidance. Uh, this is where it started with the Faculty Senate Subcommittee on Diversity. This group of, we were sitting around um, discussing, we just formed this subcommittee. There was no idea of what we were going to do. And they asked like, oh, what should we work on this year? And I suggested disability, and all these open-minded people embraced it and seized on it, were enthusiastic about it, and helped make it happen. So Iris Gibbs was the head of that subcommittee, or is rather. Phil Harder, who's the president of the Faculty Senate, and Una, Vinicio, Jean-Louis, Daniel, Marcia, and Daryl, my colleagues on that subcommittee, without whose support and championing early on, SMAC would not exist. I'd like to acknowledge my board of directors. Um, this is Corey Poffenberger. She's a doctor in emergency medicine. Jean-Louis Horn in anesthesia. Christian Bauer-Rowe, who's a medical student. Anna Kuwabara, who's a resident in PM&R. Richie Sapp, also a medical student. Zina Jawadi, who is going to be starting medical school at UCLA in the fall. She was the chair of the Stanford Disability Initiative and has probably been my like number one educator ever since SMAC was formed. She put me in touch with MSDCI. She put me in touch with Lisa Meeks, and I really consider her the co-founder of SMAC. Heidi Feldman from pediatrics, also a valued advisor, and Karina Marie Aparici from radiology. And all of these people helped me out and have been moving SMAC forward. And getting closer to the end here, I'd like to acknowledge, of course, our speakers, Holly, Nat, Lisa, Nicole, and Chris. I learned so much from you today, and I feel like our friendship has only deepened throughout this time, and I can't wait to see you guys in person, hopefully at the Coalition Symposium next year or even sooner. I'd like to acknowledge our guest moderators, Alina Engelman, Purna Kushalnagar, Bonnie Sweener from Hopkins, Christy Kirshner, and Satendra Singh. Thank you for being brave and wading into this breakout room experiment. I could just ignore my picture on there right now and focus on Zainub. Zainub, thank you so much. You and MSDCI, especially, Christian Eric, but Lily and Shayna and Richie and everybody have inspired me. I'm so proud to be your advisor, and I'm inspired by you all the time. Keep on pushing me to be better. Um, this little lady here, that's me. In case you don't recognize me, back when you could get a haircut in the United States, or at least in the Bay Area. That's my wife, Diana. I've been home since February, kind of sequestering myself from the coronavirus. And, during the day at work, I have my volunteers to help me out, but without her, I wouldn't have been able to stay home. I wouldn't have been able to um, plan this conference. And, I rely on her support and love as my best friend. And she is pregnant right now and we're going to have a baby at the end of July. And so thank you, Diana. Um, it wouldn't be appropriate to end this conference without uh, making reference to Black Lives Matter. And this is a billboard that was put up over by Chicago O'Hare uh, Airport by the Society of Academic Emergency Medicine. Racism is a public health crisis. We are committed to reducing disparities in the emergency department and to providing compassionate, unconditional care for all who need it. And that says a lot. And this goes for everyone, right? Compassionate, unconditional care. And so it's important that we support our allies during this time and realize that if any member of our society is disrespected or treated poorly, then that affects all of us, and we cannot stand for that. Lastly, this is how you can claim CME. This activity has been certified for 4.5 hours of continuing medical education. I'll post this on the SMAC website also for those of you who can't get it down in time. This conference has been recorded. It will be edited and then shared online. I don't know the timeline for that. I would guess within a week or two. It will be closed captioned. We will have transcripts available. We have all of the presentations online in a box folder. You should have the link for that. If you don't, we can get that to you. And finally, thank you to the audience for spending this Saturday with us on June 20th. And thank you for participating, for sharing all of your thoughts and insights, and for teaching us a lot.